This video covers the case entitled The Healthcare Analytics Landscape in Singapore, Evolving to Deliver Better Care. After a brief synopsis, I will describe the learning objectives and key lessons. In the span of half a century, Singapore's healthcare system had undergone a major transformation along with the country's economic growth. From a developing nation plagued with tropical communicable diseases and malnutrition in the 1960s, Singapore had progressed significantly to become the second healthiest country in Asia in 2019, according to Bloomberg. Successive reforms had enabled Singapore to transition from providing residents with basic healthcare services in the 1960s to service quality and cost effectiveness in the 1980s. In the Healthcare 2020 Masterplan, the country prioritized improving accessibility, quality, and affordability of public healthcare services to cater to the future needs of an aging population with longer life expectancies and declining birth rate. To this end, data analytics could play a catalytic role in facilitating the successful implementation of the master plan, and by the late 2010s, several data analytics initiatives had been carried out by Singapore's restructured public hospitals. For example, in patient treatment and preventive care, data analytics was used to reduce waiting time for surgery patients and to forecast diabetic patients at risk of developing serious medical complications, respectively. Looking ahead, what would further propel the adoption of healthcare analytics in Singapore? After examining the case, you should be able to achieve the following learning objectives. First, achieve broad awareness of the healthcare landscape and stakeholders in Singapore. Second, appreciate the advantages and disadvantages of centralized and decentralized management of data in Singapore's healthcare landscape. Third, understand the role of open data to facilitate co-creation of healthcare solutions between the government and the public. Fourth, gain an overview of the real-world applications using data analytics in healthcare settings. And finally, appreciate the trends in smart healthcare and the role of self-care in an urban context. So how has healthcare in Singapore progressed over the years from the 1960s to the 2010s? In the 1960s, Singapore's focus was on basic public health, such as building the public sanitation system, providing school health and dental services, childhood immunizations, and running campaigns against littering and smoking in public places. In the 1980s, Singapore shifted the focus to attaining an efficient and cost-effective healthcare system. In the 2010s, Singapore made another shift to leverage data visualization and predictive analytics to empower decision-making in both operational and clinical aspects. In the previous decade, 2010 to 2020, Singapore had gradually moved toward the use of big data and Internet of Things in areas such as community care and self-care. Refer to Figure 1 shown here for an illustration of Singapore's healthcare transformation journey from the 1960s to the 2010s. Why does Singapore choose to focus on technology-enabled solutions? Some reasons are, first, high labor cost. The use of technology addresses the cost issue as automation replaces some of the manual work. Second, human resources are Singapore's greatest assets. Human capital is one of Singapore's best aspects to leverage on to embark on innovation initiatives. Third, basic healthcare needs have been satisfied. As such, Singapore could move on to meet more advanced healthcare needs by using technology. How did Singapore ensure that Singaporeans always have access to good quality and affordable healthcare through its Healthcare 2020 Master Plan? Refer to Exhibit 1 in the case, which may explain the access and coverage of Singapore's healthcare landscape. There are three aspects to consider. The care landscape is divided into primary care, acute care, intermediate and long-term care, social and community care, and preventive care for residents. Another aspect is that specialty needs are addressed through the specialist clinics, for example, an eye center and a national cancer center. The third aspect is the clusters grouped according to regions: Western, Central, South, and Eastern Singapore. Each cluster provides end-to-end care for residents living within that region, hence ensuring every resident has fast access to health care. Starting from 2017, the provision of healthcare services have been consolidated into three clusters. While MOH Holdings, an integrated healthcare information system, support the clusters, how does this structure enhance the national healthcare system, together with the efforts by the healthcare institutions and research centers? According to the World Health Organization, a typical healthcare system is made up of a set of interconnected components comprising 6 building blocks: service delivery, healthcare workforce, information and information systems, medical products and technologies, financing, and leadership and governance. In the Singapore context, the three clusters are directly in charge of service delivery to residents, while MOHH and IHIS play a supporting role to the clusters by ensuring consistent quality of care, infrastructure, governance, and consistent policies such as subsidies, pricing, quality of drugs, and doctors. MOHH's role in particular is to oversee sector-level initiatives including first, developing and building regional and community hospitals, specialist centers, polyclinics, and nursing homes to prepare for future demand on public health care. Second, providing a system for joint recruitment of healthcare professionals for Singapore's public healthcare institutions. Third, developing a national IT framework that facilitates seamless delivery of care to patients. Fourth, operationalizing a talent management and HR framework for the entire public healthcare spectrum. Fifth, optimizing selected finance-related functions within the MOHH group. Sixth, providing corporate advisory and support to MOHH's subsidiaries and creating a corporate development system to support future organizational developments in the MOHH group. Finally, providing strategic and operational board secretarial support for MOHH's group of entities. MOHH, therefore, takes charge of three of the building blocks, namely workforce, financing, as well as leadership and governance. IHIS, as the technology arm of MOH, aims, quote, to improve our population's health and health administration by integrating intelligent, highly resilient, and cost-effective technologies with process and people, close quote. IHIS's role covers the remaining two building blocks, information systems and medical technologies. Together, MOHH's and IHIS's back-end support enables the three healthcare clusters to focus on their core capabilities of serving residents on the front line. The public healthcare institutions in the three clusters, together with those in the private sector, deliver acute care services to the population. Fourth, looking at Singapore's healthcare ecosystem, do you think healthcare data is centralized or decentralized? In what ways do you think the data is centralized and decentralized? Singapore's healthcare data is in fact both centralized and decentralized, i.e. a hybrid model. First, centralized data includes NEHR and some of the integrated data managed by centralized structures such as systems in IHIS. And second, decentralized data includes bed management, wards, surgeon information, transactional data, for example billing, in each healthcare institution. What may be some of the arguments supporting and against centralized, for example NEHR and data in eHints, and decentralized data management? The arguments supporting centralized data management include continuity of treatment across different healthcare institutions, accurate, up-to-date, and complete information about patients at the point of care, reduction in the number of medication errors and unnecessary investigations, improved efficiency and communication of care providers, securing sharing of electronic information with patients and other clinicians, and secure sharing of electronic information with patients and other clinicians. On the other hand, the arguments supporting decentralized data management include facilitation of operational autonomy, protection of personal data, empowerment and motivation for each institution to innovate, and reduced dependencies and red tape. The arguments against centralized data management can be regarded as the opposite of those supporting decentralization, and conversely, the arguments against decentralized data management can be regarded as the opposite of those supporting centralization. Who may benefit from the deployment of open data on data-driven healthcare solutions? At this point, it may help for you to review these two websites. The first one is on Open Data Platform Supporting Smart Nations, and the second one is on healthcare-related data. The parties who may benefit from the deployment of open data include, first, government. Open data can stimulate economic growth by encouraging innovation, better decision-making, more transparency, and efficiency in government. This may lead to higher quality of life and a more inclusive society. Healthcare providers. Healthcare providers are more motivated to improve efficiency of service delivery, catalyze service provider accountability, and help patients make more informed choices about their care. And third, patients and the public. The public and patients may benefit through increased awareness of the open data concept, co-creation of solutions, and empowerment of decision-making and better choice of care. Open data facilitates evidence-based healthcare and resident co-creation of solutions, especially in the urban context. Do you agree or disagree with this statement? The reasons supporting the argument are the same as those in question 5A. On the other hand, the reasons against the argument are fourfold. First, low level of data granularity. The data as of 2020 is too aggregated to be used for the development of solutions. In 2007, the U.S. government recommended a set of 8 principles on open government data, one of which is that the data has to be collected at the source with the highest possible level of granularity, not in aggregate or modified forms. Second, lack of utility and usability. Many open government data sites lacked utility and usability. According to a research study conducted in 2012, several open data projects under investigation were little more than websites linked to miscellaneous data files, with no attention to the usability, quality of the content, or consequences of its use. Another survey of 5 governments, Australia, Canada, India, the UK, and the USA, open data portals in 2018, found that usability was generally lacking. The researchers recommended providing additional features such as advanced search capabilities, data visualization, and analytics tools to encourage utility. To increase reusability of open data, training, proper materials, documentations, and guidelines to support stakeholders were suggested. The third reason against the argument is that it concerns irrelevant and disconnected data. Despite the availability of data, some of it is unrelated, disconnected, and irrelevant, which makes it difficult to develop solutions that cater to individual needs. And finally, a lack of funding and sustainability. One of the main critiques of open data initiatives is insufficient attention given to the economics of creating sustainability-funded initiatives. Open data portals that do not operate based on a sustainable operational or financial model risk being discontinued. With the advent of artificial intelligence and the growing awareness of AI in healthcare, how do you think open data could play a role in achieving effective data-driven healthcare solutions? Provide recommendations on how these solutions can be better developed to support the delivery of health services. Consider the Personal Data Protection Commission's or PDPC model AI governance framework. The PDPC is the key authority responsible for personal data protection in Singapore. You can use this framework to think about AI transparency, explainability, fairness, and human centricity, which are embedded in the following 2 high-level guiding principles. First, decision made by AI should be explainable, transparent, and fair. The objective is to build people's trust and confidence in AI systems. The second principle is that AI systems should be human-centric. The key consideration would be the well-being and safety of the people. Debates and discussions in the context of healthcare can center around at least 4 issues. First, internal governance, structures, and measures. Robust internal governance structures are necessary for organizations to manage their AI systems and technologies. They can adapt their existing structures and/or implement new measures. In doing so, they should consider the roles and responsibilities of the team deploying AI, as well as managing the risks involved in the deployment. Second is the level of human involvement in augmented AI decision-making. To identify the extent of human oversight, organizations may wish to weigh first their commercial objectives against the risks of using AI. Second, they can identify the unique cultural or societal norms in different countries for a multinational company or in different areas of a large country, for example, urban versus rural. Finally, it will be helpful if they determine the level of risks to which individuals and organizations are exposed. Third is the management of healthcare services and operations. Data quality and the appropriate data selection are essential to building good models in the development process. Good accountability practices include an understanding of the lineage of data, i.e. the source, collection, and flow of data within the company, and reducing biases, for example, selection and measurement in the data sets and model, ensuring data quality in terms of accuracy, completeness, veracity, recency, relevance, integrity, usability, and determining the extent of human interventions during the process is also critical. Fourth is stakeholder interactions and communication for sustainable solutions. Trust is an important element in stakeholder relationships. Organizations can foster trust by disclosing their use of AI in their products and or services, provide the option for users to opt out of the use of AI, and communicate to stakeholders in a way that is easily understood. What's important is the readiness of Singapore's healthcare industry based on the above points. Can you think of recommendations on how these solutions can be better developed to support the delivery of health services? Who do you think is responsible for an individual's health, public healthcare or self-care? Both are responsible. It may be useful to review these two links, which provide supplementary information from published articles and research papers. Self-care is an individual's first step in maintaining good health. For some people, for example the poor living in remote areas, self-care may be their only practical option, and for others their preferred option before seeking professional care. In Singapore, the government encourages residents to adopt responsible self-care habits to reduce reliance on the public healthcare system. When it comes to treatment of illnesses and diseases, care goes beyond an individual's means, and that is when the public healthcare system steps in to provide different levels of care: primary, acute, intermediate, and long-term, as well as social and community care. As a critical part of the larger healthcare ecosystem, the primary goal of public healthcare is to improve the health outcomes of the general population. Why do you think Singapore could attain observable success as a smart nation, not just a smart city, to bring smart healthcare to its residents? Some of the reasons are as follows. First, Singapore is a small nation with a small population, and hence it might be easier than larger countries to establish common standards for infrastructure such as NEHR, SingPass, National Broadband Network or NBN in every household. Having established basic health care, including the provision of key services such as health education, sanitization, clean drinking water, etc., Singapore is in a good position to focus on using technology as an enabler to reach the next level of care. For example, the Aging in Place Shine Seniors project is possible due to the nationwide infrastructure that was established. Singapore is considered a socially cohesive society, and in the prevailing climate of public harmony and the absence of civil disobedience, the government is able to implement smart nation initiatives successfully. This case presents an overview of the healthcare landscape in Singapore. Through the case, you have the opportunity to compare approaches of data management, centralized versus decentralized. In addition, they would explore the role of open data in facilitating the co-creation of healthcare solutions by the government and residents, on the use of data analytics in healthcare. In addition, you can use the case to explore the role of open data in facilitating the co-creation of healthcare solutions by the government and residents. On the use of data analytics in healthcare, you can gain an understanding of the prevailing issues and constraints. Finally, the case is designed to help you appreciate the trends in smart healthcare and the role of self-care in an urban context. Thanks for watching the video.